One of my most favorite technique to treat acne scar is the subcision technique. That means the cut of the fibrosis below the acne scar. The technique can use traditional Nokor needle. You can see that this needle had the special tips with the blade-like shape. This usually the 18G size. This is quite large compared with the traditional other needles, and it's very sharp to cut the needle in the traditional way. So we use the no-core needle to cut beneath the acne scar, especially for the rolling acne scar, to create the space with the haematoma, so the scar can regenerate and remodeling. Uh, Traditionally, we insert the no-core needle into the subdermis area. You will feel the resistance from the fibrosis. Today, there is a newer method to treat the acne scar with the subcision technique. We call the blunt cannula subcision. Blunt cannula that used to inject the fillers like that. The brand that I use is the TSK cannula. I think this is the best cannula in the market to inject the filler. The price is quite expensive, but they are very flexible. You can pass some of the fibrosis. You can bend with the some of the area with the cheek on the bones, something like that. We will insert the cannula into the subdermal area and then cut the fibrosis. The advantage of the blunt cannula subcision is you can, with one entry, you can reach many area, and also the fill area of the acne scar with the fibrosis. And also you can inject some filler, PRP, pellet plasma, or polynucleotide ligand when you after you subside the fibrosis. So we have the simple needle, no core needle, and blunt cannula. We also have the modified cannula that used for the fat transfer, that had a surrogate tips, so we can cut more of the fibrosis. If you have if the patient have a lot of fibrosis, so we can use this special type of the needle, but we have to use the two medicine to block to prevent the pain, and also improve the procedure process. We use the hydro sector. In the clip, you can see that after we cut the fibrosis, we can inject the filler or PRP or polynucleotide after that. In this clip, I use the needle, and also I will use the cannula to cut the fibrosis. So the subcision technique is a good, especially for the rolling scar or severe scar with significant fibrosis. This method is have the many advantage than the simple no core needle. You can see that with one entry we can enter to cut many fibrostic area, especially in the cheek area. So this is one of my favorite method to treat acne scar. We can have many sides of the needle and also the cannula. And also we can combine with usually I combine with other procedure after the subcision. I will combine with the laser, because the laser infinite micro needle IF. The downtime you may have some of ecchymosis or bruising for a week. You can compress with the ice, and then the symptom will resolve in a few weeks. You will see the result in a week or 2 weeks or a month when you combine with the laser. I would like to share my technique to treat acne scar. If you have any question or you would like to see the result, you can see in my YouTube or my Facebook, Dr. Suparuj, DRSUPARUJ, but mostly are in Thai, so I try to develop the others channel, so we can share the ideas with the others dermatologists or colleagues, something like that. Please feel free to comment, give me a comment or give me the suggestion. Thank you so much. Nice to see you all.